I just want to remind everybody to please silence their phones or any other electronics that they have with them. And if you want to speak on today's agenda, speaker slips are available at the front table. That would be item number 3 for non-agenda public comment. Thank you. Amanda, you'll let me know when the online is ready to start.
We're there.
Not trying to rush you. Just
No.
make sure I know so I don't get started before you're ready.
Yeah, we're ready. Did you hit record? Yeah, we're ready.
You're ready. Okay. I think it's 5:30. We can get going.
Yes.
Okay.
It's all
And
set.
then is there a clicker up there that I'll be able to click?
I'll be your clicker.
Okay, sounds good. Thank you.
Good evening and welcome to tonight's meeting of the San Diego County Law Enforcement Review Board. Adele, if you could please call the roll. Here.
Here. Yes, here.
Dr. Brown,
Here.
Mr. Loomis,
Here.
Mr. Moody,
Here.
Dr. Thomas,
Here.
Mr. Woods.
Here.
Yeah, we see Mr. Ware and I know Ms. Federica Montero on the line.
Great, we'll call her in when she arrives. I don't believe we have any board members that are participating online tonight, so we don't need a statement of cause. We will move to item number 3, which is public comment. This is an opportunity for members of the public to address the board on any subject matter that is within the board's jurisdiction, but not an item on today's agenda. Amanda, if you could please call
Yes.
the first speaker.
Our first speaker is Gabriel.
Say the name again, I couldn't hear.
Gabriel.
April.
Gabriel is, no?
Gabriel,
Okay.
are you here?
We'll move on to David.
Yes, hello, clerk. Again, I'm David Settles once again. I think maybe there are some new faces, but once again, my brother, Matthew Settles, passed away at George Bailey. That was in August of 2022, so 3.5 years ago. I think you know the story. You know, my brother had schizophrenia a long time since he was in college. You know, he was in the county mental hospital, and he really got no treatment when he was put in jail and was put into ADSEG. So, you know, once again, I'm here for to, you know, represent my brother. You know, thank you for all the work you're doing, and you know, I am excited that you know, the clerk now has the jurisdiction over the medical personnel. We do absolutely need the improvement. So, you know, please scrutinize these cases and the treatment that patients do get in our jails. I mean, they're not convicted. They're just, you know, not you know, not only getting the treatment, but getting, you know, putting, you know, severe mentally ill person into ADSEG is really just cruel. And you know, my brother should not have passed away like that. And so I'm just here representing him, and I just want to once again thank you for all you're doing, and thank you for letting me speak.
Thank you for being here.
Thank you. Next, we will call Paloma Serna.
Hello?
Forgive me if I don't pronounce these names correctly. My name is Paloma Serna. I'm the mother of Elisa Serna, who died on November 11, 2019.
in custody due to medical neglect. I am with North County Equity and Justice Coalition and Saving Lives in Custody, California. I'm here today to speak on the death of Latoya, Vitale, and Bobby Ray Patton Jr. These are not isolated incidents. They are part of a pattern. Few human beings enter custody alive and do not make it out. And what we continue to see is the same question over and over again. Why do individuals have to beg for help inside San Diego County jails? Why are people crying out in pain, asking for medical attention and mental health support and being ignored? Why does it take a death for anyone to listen? Families are left with more questions than answers. We hear titles like Deputy 1 and Deputy 3, but not names. We hear summaries, but not truth. We hear conclusion, but not accountability. Transparency is not optional when someone dies in custody under Kelly Martinez's watch. If deputies were involved in the care, supervision, or failures to act in these deaths, then their identity should not be hidden behind labels. Deputy 1 and Deputy 3 have names, and the public and those families deserve to know who they are. Because without names, there is no accountability, and without accountability, these deaths will continue. So I ask you, what changes have been made since Elisa's death? My answer is none. Nothing has changed. This year alone, there has been 4 deaths, 3 inside facilities and 1 outside. This is not just about these 2 individuals. This is about every person still inside those facilities who may be begging for help and not being heard. And it is about every family who is left behind. Name the deputies involved, demand transparency, because every case is a life, and behind every life is a family. Thank you.
Thank you. Next, we will call Karen.
Sorry, Yusuf Miller. Yes.
Next, we will call Yusuf Miller.
Good evening. My name is Yusuf Miller, North County Equity and Justice Coalition, Saving Lives in Custody, California. And we are now at 3 in custody deaths, and we have others that are on the streets as well. And it's a bad trend. We're looking at a bad trend. We're just starting the 4th month of the year, and it puts us in a trend of 12 at the end of the year. We hope and pray that that's not the case. But if that is the case, then we're outpacing ourselves from last year, and that is not what we're looking for as far as accountability, transparency, the mental health advances that we're trying to make. I understand the Sheriff's Department is working on a mental health initiative this year. So is the Saving Lives in Custody, California. And we had a in-custody death, which resulted from a hanging, self-hanging in the jail. So these kinds of issues, whether we ask them the question, were there timely checks? Was the person properly classified? These questions we've had for years. And some of our impacted family members, who will most likely be online, has suffered from those kinds of failures. And here we are with some deja vu and re-traumatization of those families by knowing that someone has hanged themselves in the jails. So we ask for more stringent and more intentional looks at what's going on in the jails mental health wise. I understand that we're empowering a mental health doctor, sorely needed, and hopefully we get that person in place. And also we would like to invite that person to speak to the community, let the community know what their plans are for moving forward in the mental health arena. Thank you.
Thank you, Chair Pintar. That concludes our in-person speakers. Next, may we call our online speakers? Karen Anderson, are you there? Okay, next we will call Dean McCloy.
My name is Deidre McLeod, and I am a constituent of Supervisor Joel Anderson, District 2. My pronouns are she, her. I have 3 issues to speak on tonight. First, I'm really hoping that EO Kalina misunderstood my comment last month in the immediacy of a public meeting. But whether it was a miscommunication or not, CLERB's mandate is to investigate deaths of formerly incarcerated persons that happen within 6 months of release, and there needs to be an official process in place to identify such jail-related deaths more substantial than, well, if we hear about it in the news, we'll do something. That is completely unacceptable. Second, I'd like to recognize Board Secretary Fasano for having the courage to not just dissent in the case 25-120, but publicly present her reasoning for differing from the majority finding. Being the lone voice disagreeing with the majority is never easy, but someone has to take that step if the people of San Diego are ever going to see justice. I appreciate Secretary Fasano's action, and I welcome further such transparency from CLERB. Third, in the last 6 months, the City of San Diego's Commission on Police Practices has had presentations from 3 community groups: Mid-City Can, MOGO, and Pillars of the Community. In the last 6 months, CLERB has had 0 presentations from community groups. Instead, counting tonight, you have had 3 presentations by the Sheriff's Office, 1 by probation, and 2 others by county departments. It is imperative that this board start hearing from other voices in the carceral justice space and not just serve as a mouthpiece for propaganda from the sheriff and probation department. Again, I ask that this board consider at least switching off months between community organizations and law enforcement so that the knowledge and information you are drawing on while deliberating is balanced and fairly represents the experiences of all the people of San Diego. Thank you.
Thank you. Next, we will call Leslie Crawford. Leslie, can you hear us?
Yes, I can. I normally give up my minutes because I'm not a good speaker. My son, Raymond Vogelman, passed in George Bailey, October 5th of 1922 or 2022. But nothing's changed. All I can do is follow and try to support those who are suffering the same thing. It all comes back. Most of these people get into incarceration through mental illness, of which there is not any ready help for people who have parents or children suffering. And none of these people have been in jail for very long, and they certainly haven't gone before a court and be sentenced. And I see no difference. And what saddens me is the sheriff's department. The head of the sheriff's department have a philosophy that even exists in Riverside, that any incarcerated person is guilty by association because they're there. They don't really care where they're there. They don't concern themselves with mental illness. And it makes me so sad that it's almost 3.5 years and nothing has really changed that I can see. And like the prior speaker said, they are a very strong voice and people don't listen to the community. I just want to say that this pain never goes away and it keeps happening. I see other parents, other family members having to suffer this pain. I know David Settles is still suffering like I do, and his brother died the same couple months apart in 2022. Police try to take more attention to the attitude of the management of sheriff.
Thank you. Next, we will go to Daniel Castro. Daniel, we do not see your name or your hand raised. Please raise your hand if you're online. Next, we will call Gabriel. Gabriel, if you're online, please raise your hand. Okay. We'll move on to Karen Anderson. Karen, if you're online, please raise your hand. Okay. Chair Pintar, that concludes our online speakers. May we move on to our written statement?
Yes. Sorry, did someone submit a statement? to
Yes.
Is that what you said? Please.
This written statement is from Tom Packard. It states, I appreciate the sustained findings on the Bobby Ray Payton Jr. case. For that, the recent suicide case and others go beyond your usual analysis to fully evaluate every step to identify specific behaviors that contribute to these and other deaths. Demand that the sheriff list specific changes made to prevent deaths in the future. How could each death have been prevented by better staff behavior? That concludes the statement.
Thank you. That concludes our public comment for item number 3. We move on to item number 4, approval of the minutes. Is there a motion to approve the minutes from the March 5 meeting?
So moved. I second the motion.
So a motion by Dr. Brown and a second by Mr. Mendelson. When you're ready, Secretary Casano, please call the roll.
Chair Pintor,
Yes.
Vice Chair Mendelson,
Yes.
Secretary Casano, yes, Mr. Bishop,
Yes.
Dr. Brown,
Yes.
Mr. Dumas,
Same.
Ms. Federica Longo,
Yes.
Mr. Moody,
Abstain.
Dr. Thomas.
Yes.
Mayor Thompson, and Mr. Woods.
Yes.
Okay, the record shows the minutes are passed by a vote of 9 in favor.
Thank you. We'll move on to item number 5, presentation and training from the Sheriff's Department, Sheriff's Office, Lieutenant Aaron Moline, who will give us a presentation on contraband and narcotics interdiction.
Just one moment to get that up for you.
Actually, just before you get started, for the record, Secretary Casano Ariana arrived at about 5:38. And she's now present. Thank you.
Good evening, everyone. Thank you for having me out tonight. Appreciate it. My name is Aaron Moline. I'm a lieutenant with the Sheriff's Department. I oversee our detention investigation unit, which covers our jail investigators, our mail processing center, as well as our contraband and narcotics interdiction team. So our CNIT team was created back in 2023 as a way to help combat the any types of narcotics or contraband or weapons that were making it into our facilities. It started off as a pilot program, got up and running about mid-2023, and it's now a permanent program and has been a permanent program for the last couple of years. The CNIT team operates out of our 3 intake facilities, and each of the intake facilities has a sergeant assigned to that facility, which oversees the CNIT team. They are out of Las Colinas, San Diego Central Jail, and our Vista Detention Facility. So part of our CNIT process, as our arrestees come in, our deputies will go into the databases and conduct some research into this incarcerated or this arrestee. We're looking at prior criminal history. Do they have priors for bringing drugs into our jail facilities? They'll read the probable cause declaration by the arresting officer, kind of do a deep dive into what they're running for and what their history looks like to see, is there a potential that they may be trying to smuggle drugs, weapons, or contraband into our jail facilities. From there, our team will conduct a very thorough pat-down of the person coming in, and then the next step in the process will be going to our body scanner, which will conduct a body scan to see if there's any type of anomalies that the deputies are able to see when they go through that process. So if you look at the photo on the far left, this is an example of what the body scan will look like. The orange arrows there has identified an anomaly there. So the deputies go through the various trainings to be able to read and understand and interpret these body scans. They take into account what the body scan looks like, as well as the history of the arrestee coming in. to make a determination whether we're going to accept that arrestee into our custody, or do we see maybe something that may be internal inside that person that necessitates having the arresting officer take them to the hospital to be cleared at the hospital with additional imaging done there. Or if we see that there's drugs inside of there and they need to be sent out to the hospital via ambulance, via 911 activation. Keeping in mind that our body scanners are not 100% foolproof with this. There's a lot of the background investigation that goes into it, and then interpreting what the images look like. Depending on the size of the person, we may have a cleaner image. Depending on if they're constipated and backed up, we may see the image may not be as clear. So we're only as good as what we're able to review with the image. I'm also taking into account cooperation from the person standing still so the imaging can be done. From that process, if they're cleared from there, we'll bring them inside to our facility. If there's any additional questioning or what we call our secondary process that we make a heightened concern that there is something there, we'll collaborate with our medical staff as well to determine if our medical staff wants to do any type of X-ray imaging that they would like to order to see if there's a medical necessity for it. Obviously, if someone has, like if you look in the photo on the far right, those are a couple of bundles of drugs that were captured later on. Our concern there is that's a medical emergency. If someone has that inside of them and the X-ray imaging shows that, we want to get them to the hospital as fast as possible. So that will trigger a 911 activation to send them out via ambulance, because we want them to be in the best place possible for care in the event that that were to rupture and it were to create a So looking at this slide, we have a 2024 versus 2025 comparison in the green on the left-hand side. Those are the total number of bookings per our 3 intake facilities that occurred during those years. Every single person that comes in as an arrestee to our facility goes through this CNET process with the enhanced screening. And then if you look in the light blue on the right-hand side, I mentioned our secondary process. Those were the number of arrestees that came in that were referred to our secondary process. And then on the bottom, in 2024, we rejected 190 arrestees coming in, and 2025, we rejected 309. Now, the rejection just means there was something seen during the initial intake process before they have their wristband put on and they're inside of our facility. The deputy saw something and we said, we're not bringing this person into our custody right now. We have a concern that there's potentially something inside of them. We need to send them to the hospital to have a doctor do additional imaging to be able to determine if there is any type of weapon, drugs, or contraband inside of them. So that's what those are on the bottom. In 2025, we rejected 309 arrestees coming in. Now that doesn't mean they won't come back. Once they go to the hospital, the arresting officers will get them cleared to the hospital, have medical paperwork filled out saying they were cleared, and then they'll come back and they'll start the entire screening process all over again. So in 2024, 2025, here's our comparison for contraband that was seized. So these are number of instances that contraband was seized and at what point in the process were they seized. So as you can see in pat downs, that's where we find most of the weapons, drugs, or contraband that come into our facilities. In 2025, we had 464 instances where something was found during the pat down. That's the initial portion of the intake process. From there, they go to the body scanner, and we had 99 instances where something was found in 2025. And then there's also the strip search and the X-ray. In 2025, we had 98 items found, or 98 instances where items were found during the strip search and 14 during the X-ray process. And then on the right-hand side, it's an example of something that was passed based off of a supervised bowel movement. So part of our secondary process is keeping, so as these folks come in, when they're placed into our secondary process, we're keeping them separate from our general population while they go through the screening. What we don't want to have happen is for them to be in one of the holding cells with the other arrestees, have them have something that's on their person to where they can produce that and then hand it off to somebody else. So in order to protect them as well as protect the arrestees that are already in our custody, we keep them completely separate until the CNET process has been completed. So looking at this is the various types of contraband that has been seized. Again, this is number of instances that it happened. So we took that previous page where it was found and we broke it up into actually what it was. So in 2025, we had 427 instances where drugs were found, 2 where it was drugs and a weapon, 19 times where it was a weapon, and then 288 others that we classified. That could be that they had cigarettes, that could have been something that was a lighter, but it didn't fall under the category of drugs or weapons. In total, in 2025, we had 8,526 no contraband seizures with a total of 736 times where we seized it during our secondary process. So here are just some of the seizures that our team has found. On this one, a deputy identified an anomaly during a body scan. This person was sent off to the hospital, and at the hospital, this person produced 188.06 grams of fentanyl that they had internal inside of them that was seen on the body scan. So this is a prime example as to why we want to keep them separated from the other arrestees that are already in custody when we see something, because had they been mixed together and this were produced in one of the holding cells, they could easily pass it off to somebody else, and then it's much harder for us to track where that went. So until they're cleared from the X-ray and through the entire secondary screening process, we will keep them completely separate from everybody else. So this was, the person came in, they were placed into our secondary screening. Medical determined that an X-ray was appropriate, so medical ordered an X-ray. The X-ray technician took the X-ray, and this is where 3 bindles containing 54 grams of fentanyl and 15 grams of methamphetamine were found. So if you remember several slides back, we had the picture of the X-ray where it showed the 3 different bindles. That's not necessarily this one, but that's what is seen on the X-ray imaging, and this is what will be passed either at the hospital or if the person did a supervised bowel movement. This is an example of what we would collect during a supervised bowel movement. In this one, the CNIT team conducted a body scan of an individual, discovered an anomaly in their pelvic region, and these bindles contained 102 grams of methamphetamine and 10 grams of fentanyl that were found during that process as well. And then with this one, again, we had one of our CNIT members identified an anomaly during an X-ray portion, and this person was found to be in possession of 72 grams of fentanyl. So, when we look at our CNIT process, I know our sheriff has implemented various other avenues to combat overdoses in our facilities. In 2023, we had a total of 83 overdoses, and we look at everything else that the sheriff has implemented along with our CNIT team working together with them. And I'm happy to say that as of the end of 2025, we've had a 62% decrease in our overdose cases. We're constantly looking at various technologies and shifting how we're handling our CNIT process, the intake process, as we see that the method of bringing drugs into our facilities is changing. We will modify how we're handling our searches and our secondary processes as well. With that, I'd be happy to take any of your questions.
Questions from board members? Dr. Brown and then Mr. Madison.
Question from the thank you. Very. I probably asked, but what happens to those people? What happens?
It's Dr.
to
Brown.
individuals?
Sorry, is your microphone on?
Okay.
I want to be able to hear you.
I'm trying to. It's on.
Yeah, it sounds like it's on now.
Thank you.
Thank you.
Thank you.
What happens to the individuals when you find as contraband on them? Are they penalized more, or what happens? Is there a certain crime or statute?
Absolutely. So it's a felony to bring drugs into our facilities. We have plenty of signage in all of our intake facilities and in all of our housing units that discusses the penal code section for bringing drugs into our facility. When we do get drugs that come in, our detectives will complete a crime report on it, or the CNIT deputies will complete a crime report on it, and then once the investigation is done, it is forwarded to the district attorney's office to determine if they would like to file charges.
The other question I have is, I know you are keeping COPIS keeps a lot of notes and records on when incidents happen, the night, the day, how many, what, during the shift and everything. Who breaks down that data? Who's looking at that data and using it to reduce instances of liability or what have you? Who's looking at the data when it's, say, for example, more of this might happen on a Monday evening on the second shift. You know, who looks at that and makes recommendations to either increase the staff or what happens?
Absolutely. Great question. So it's a collaborative effort, not only between the detectives in my unit, our senior team, our senior sergeants. We have analysts. We have one analyst that works out of our office. Our analyst is constantly collecting the data. She provides it to me as well as to our command. We work in conjunction with our facility commanders as well as the watch commanders that are working on the team to ensure that we have adequate staffing with our senior program. And they will make the necessary staffing adjustments as it takes place, as well as the various recommendations as to different tactics as our deputies are seeing the various ways that drugs are coming in. They'll communicate that with us, and then we're constantly pivoting so that we can make sure we're combating the drugs that are coming in.
Thank you. That's all I have. Thank you.
Before we go to Mr. Mendelson, I just want to remind members of the public that we do have public comment on this item, on this presentation. So if you want to make a comment, please submit a speaker slip so I can get to you when the board is done with their questions. Mr. Mendelson.
Thank you, Lieutenant. Thank you for the presentation. I know that in other counties and in CDCR, Department of Corrections and Rehabilitation, there's a problem with people getting drugs into the inmates via mail. There's ways you can iron on drugs, stuff like that. Do you all have experience with that, mail searching, or anything you can tell us about what you're doing to combat that?
Absolutely. So the mail processing unit falls under my unit as well. We have 4 deputies that are assigned to our mail processing center, and they screen every single piece of mail that comes in. In the event that they do have a narcotics letter that does come in, they will capture that, put that into evidence, write a crime report associated with it, and then our detectives will follow up on who it was trying to get to, which a lot of times the intended recipient isn't necessarily the person who was addressed to. But they'll look into determining who the intended recipient was, and then we try to work the case out to figure out not only who mailed it in, but who created it and who the supplier of it was as well.
And I won't ask you what techniques you use because I don't want to compromise that, but I'm assuming that you do. Visitors, I know that in other counties in the prison system, there's issues with visitors being able to pass things. There's even cases where criminal defense attorneys have brought in drugs and narcotics. Have you all had any experience with that?
To my knowledge, we don't have any person-to-person contact when it comes to our social visits. Now we do have professional visits that do take place. And in any instance where we have concern or belief that drugs were passed in that way, we will take the investigative steps necessary to determine how that occurred as well.
I know that in CDCR, and I've heard about other places where actually sometimes jailers are the ones that are introducing the narcotics into the facility.
So I've been in our jail investigations unit for a little over 2 years now. I have not come across a case where that has been the instance. But if that were the case, we would take that and we would work the case as well. We would work in conjunction with other units on our department to ensure that that case was handled appropriately on the criminal side.
And then the last 2 questions I have may not come right under the CNIT responsibilities, but one has to do with Pruno, which is a jail manufactured alcoholic beverage where I guess they get fruit out of their commissary and chow hall and able to get it to become a very intoxicating substance. Do you all have any issues with Pruno?
Yes, we do. Same thing with those. So if those are found during on the line by our deputies, they'll write the crime report on it, and then we will submit the lab testing request for the Pruno to determine the alcohol content. Once our follow-up is completed, we will forward those cases to the district attorney's office as well to determine if they will issue on that case.
And then the last question about an item of contraband that I know that in some other counties or in the CDC, a real problem with the introduction of cell phones and the ability for certain organized criminal gangs and all that to conduct business, to facilitate drug trafficking hits and everything else. Do you all have any, or what can you tell us about what you all are doing, or whether you have any issues with phones being smuggled into inmates?
I've only seen one instance in the last 2 years where we had a cell phone that was introduced. And we pursued that, figured out the avenue that it came in, and made various policy changes on to prevent that from happening again in the future. But that case was also written, and that was forwarded on to the DA's office as well.
Yeah, and I have no further questions. I'm sure as you're aware that in the Department of Corrections, there's actually custodial officers that are making a lot of money selling cell phones to inmates. But thank you for your presentation.
I can say that on that one instance that I'm aware of, that was not a staff member that introduced that cell phone to our incarcerated person.
This is fun. And then, Mr. James.
Question is, do you work with the narcotics detection dogs? And if so, how do they screen people coming into the jail, including the IPs?
So we work hand in hand with our canine unit for our detention narcotics dogs. They don't fall under my unit, but each time we have needed to do a search, or the facility is going to do a search for drugs, they will call on our canine unit to come out and conduct a sniff.
And do they routinely screen any of the passengers coming through booking?
In our intake process?
Yeah.
Not that I'm aware of.
No. And what about visitors? What kind of screening is done on visitors?
That I would have to refer that back to the canine unit. I don't know exactly what they do with the as far as screening anybody. Our interaction with them is when we're doing a facility search, we'll bring them in once our incarcerated population has been moved out of a housing unit. We'll bring our dogs in to conduct a sniff inside that housing unit, and then follow up on any indications that the handler tells us about that.
Okay, and we can follow up. I'd like to get some data on what type of screening is being done by the narcotics.
Okay.
Where they operate.
Okay, to be clear, you're talking specifically about visitors or all over, for both incarcerated people and visitors?
Yeah, both.
Both, okay.
And where they operate. What the results have been.
We'll follow up with an email question to you. Get back to us.
Okay, Lieutenant Treasurer, we have to forward that off to the canine unit.
Okay, that's right, that makes sense. Mr. Dumas, and then Ms. Federico Mondragon.
Thanks for the presentation, Lieutenant. On one of the slides, you show that rejections from 2024 to 2025 increased from about 190 to 309, indicating that the body scans and stuff are finding more people attempting to bring things in. But then later on, there's another slide that shows that identified contrabands actually have decreased from 24 to 25. So did I miss something in the presentation where rejections increase, but the finding of contrabands decrease? How does that work?
So just because we reject somebody doesn't necessarily mean there's always something there. It's the deputies will see something on the body scan that just doesn't look normal. It doesn't look right. So they will, they'll make the determination if they want to reject that person. We've taught our deputies to err on the side of caution. If they believe something is there, we want to err on the safety of the person, not only coming in, but on the safety of the population that we have. So we encourage them to make a decision to reject that person, to send them to the hospital, to have the hospital clearance done. So with that, also seeing the increase in our rejections, we've seen the increase in our population that comes in our bookings. So I would correlate the two together. The more arrestees that you're having coming through our doors, we're probably going to have more rejections. With regards to, can you repeat the second portion of your question? I'm sorry.
Well, nothing. I think you explained it already. It was just about the discrepancy between increase in rejections and decrease in the amount of contraband. So it's just
the other thing to
more false positives.
Yes, sir. The other thing to consider too is when we reject them, that doesn't always mean that the arresting officer brings them back to us. There's times where we'll make the rejection, explain to the arresting officer why we're doing the rejection. They'll take them to the hospital, and then if it's a misdemeanor, they may just issue them a citation at the hospital. And we also, because it's another agency taking them, we don't track if anything was found at the hospital that arresting officer took and maybe wrote another criminal case and impounded that into evidence. The only time we would track that is if our deputies take them out via 911 and our deputies are able to capture something, then they would write a crime report. So we can gather statistics on when it's our deputies, just not other agencies.
Got it. And then one last question. Do officers ever go through body scans or other random searches?
This body scan process is strictly for the arrestees coming in.
Thanks.
Yours.
My question had to do with, I have a couple of questions, but I did want to know how, so you mentioned that medical staff, they help with medical assessment, support, extracting, right, some of those things. Do they offer any other support? I'm just wondering, like, for people that are bringing in contraband, are they bringing them in because they themselves are using, addiction? Like, are they assessing that as well?
Yeah, so when they go through one of the first steps in our intake process is our medical screening. We'll sit down with the medical provider that's there. The nurses will do their assessment. Our deputies are not, that's a medical conversation that takes place between the arrestee and our medical staff. Our deputies aren't part of that portion as far as interviewing them with regards to their medical history. There are times where our deputies will talk to them about their drug usage when we're trying to make a determination as to is there a likelihood that they're attempting to bring drugs into our facility. But yeah, medicals, they're the second step of the process.
Have you evaluated why people are bringing
in? So it could be a multitude of reasons.
I'm just wondering, like, from 2022, like, have you seen like trends? Is it because addiction? Because they're selling, continue to sell. Like, I'm just wondering if those are trends. I think that could be really helpful.
So there is definitely a desire to possess drugs and use drugs inside the facility. If you're a drug user on the outside and you get arrested, you're not all of a sudden not a drug user just because you came into custody, especially if you're a long-time drug user. So there's a desire to get drugs into our facility. So whether it's personal use, whether they're going to disseminate the drugs and sell them to others, there's a market to try and to buy drugs and bring drugs into our facilities. We have seen instances and talk with arrestees that are being caught with their drugs. You might have somebody that knows they're going to have a probation violation, so they're going to try and sneak drugs in, and in interviewing them, they'll tell us, yeah, it was a personal amount to use because I know I was only coming in for 10 days. This was enough to get me through the 10 days. But there's various reasons whether they want to continue to be able to use to feed their addiction or whether they're trying to sell it.
So then what happens when folks are disclosing that to you? Because I'm guessing that, you know, they have these additional criminal charges, but is there still like something that's being flagged to medical counseling?
Absolutely.
They're at like high risk, right? I'm imagining they're high risk because they're using drugs, they're addicted to that. Maybe they might come down from what's that called? Cleansing from drugs. So like, how do you flag that?
So that would be the conversation that they're having with the medical staff during intake. If they have that conversation with the deputies, they'll relay that information to medical staff as well. We also have to take into account or into context that not everybody that comes in tells us the truth. You might have guys that come and say, no, I never use drugs. And the more honest they can be during that initial screening process, the better the ability for our medical staff to be able to treat that and provide them with the medications that are going to help with withdrawal symptoms that they'll experience not having drugs while they're in custody.
Thank you. I did have a question about the pat down. So when people are patted down and you find a drug, do they still get scanned?
Yes, everybody's patted down and everybody goes to the box.
So everyone goes through the same process.
Yes, sir.
And then you did mention you do keep folks separate if you find something. And I think you mentioned like hospital, but is there a specific place that they're at? Is there more supervision? How are they separated?
So they're not placed into the normal booking tank. They could be seated on a bench outside with direct supervision from the deputies. They could be placed in a dry cell or a cell by themselves. But we make sure that they're not intermingled with our population until they've been cleared from our senior process.
And that's direct supervision, like a deputy keeping eyes on them, or can you describe?
Yeah, so they, so central jail, for example, the benches are right on the other side of the glass where the deputy station is. So you have direct observation from the deputies that are inside the deputy station, or the deputies that are doing the fingerprints working the floor. You would also have, there's cameras that are on them as well. You have your intake deputy that is, that positions, there's always someone working in the intake control position. They have cameras so they can see the person. They can also see the person through the plexiglass windows as well.
Thank you for asking that. And then, what happens to the contraband, and how does that get tracked from wherever, you know, you're taking it from someone?
So it's something
track
that-
it, how do you dispose of it?
So if the drugs will be placed in, drugs or weapons would be placed into evidence with the crime report that's written. If it's found during the intake screening where they're not our body yet, they're still the arresting officers. So say it happens during the pat down and the drugs are found during the pat down, we will photograph it and then we will hand those drugs back to the arresting officer for the arresting officer to place into evidence, and then they can write their crime report or include it in their report, however they're going to handle that. Same thing with the contraband. If we were to find a lighter or a cigarette, we'll give that back to the arresting officer. As far as if we were to find drugs, say during a search after they have the wristband and they're already in our facility, our deputies will take that, they'll impound that into evidence, and then they'll write their crime report that's associated with that.
There are like inventories on evidence? How do you track?
So the evidence is each evidence item that's entered into our record system, populates a number, as well as a barcode, and then that all gets sent off to our main property and evidence, and then however they do their inventory.
That's not under your
Yeah, no,
jurisdiction anymore. And then for your unit, how many deputy officers?
So in just our CNIT team, we have 3 sergeants and roughly, I believe we have 60 deputies that are assigned to that. And then in my detective unit, we have 13 detectives, and in my mail processing center, I have 4 detectives.
And then are those deputies that were just assigned to your unit, or are they?
So the CNIT team, the sergeants fall under, the 3 sergeants fall under the detention investigation, so they fall under me. The deputies fall under the facility, so they work for the CNIT sergeant that's there, but the operational control is from the facility.
Oh. Thank you for answering the question.
Dr. Thomas?
Yes. My question is this: what is your process if you have a false negative? You know, you do all the pat down and the scanning and everything, but that person still is able to bring something in on their person. What's your process for correcting that?
So we're constantly taking a look at our processes and trying to figure out ways to make what we do better. We rely a lot on the deputies to give us suggestions on different tactics that they're seeing so that we can make decisions and essentially pivot what we're doing. As far as if we were to have an overdose, we definitely do an overdose review specifically into that to look at how the drugs were able to make it into the facility. We'll review body scans, we'll review any extra imaging that was taken, we'll review body worn cameras, CCTV to see is there something that we could have done better, and then implement those actions. And sometimes it could just be, we had a brand new deputy working the body scanner that day, and we're just providing additional training to them, or just letting them see how the object was missed, or even pointing out on the body scan, it was right here. We also do quarterly training where we take actual scans that happened during the previous quarter, and our training corporal will go through and write up a scenario as to, okay, this person was brought in for these reasons, this person has this type of criminal history, they have this amount of priors for bringing drugs into the facility, here's a picture of their body scan. Would you accept this person? Would you reject this person? Or would you put them through our secondary process? And we're constantly updating that. That training is, you'll never see the same training twice when it comes to that, because we want to use fresh body scans, fresh scenarios that have actually, or incidents that have occurred during that previous quarter.
I just have a follow-up from a couple of my colleagues' questions. A couple of the board members asked you about whether deputies were scanned or visitors were scanned. And I think you said, no, not really. That's not something that your unit does, correct?
So my unit is not in charge of the employee screening. We are seeing a team that only does arrestees that are coming in.
Only arrestees.
Right. We're not part of the employee screening. I would not be able to answer.
Not visitors, though.
Correct. We only do the intake portion of the arrestees.
Only the intake. Okay.
Yes, sir.
Thank you. I think that concludes board member questions. Oh, yes, Dr. Brown.
Just this past week, they discovered a fentanyl, a type of fentanyl that's like resistant to all the medicines, like Narcan and everything, like in Oklahoma. Are you guys updated on this type of information? Often when they find this type of drugs, do we rely on to get updated information like that from?
So our detectives are constantly in contact with our various narcotics task force units, our war crime suppression team, as well as contacts all over the country. And as information like that comes through, our detectives will dig into that and find out exactly what's going on, and then usually they'll present that information so that we can pass that up to our medical staff so that everybody's on the same page with any new trends that we're seeing.
Okay, thank you.
You're welcome.
Mr. Bisson?
Just a quick follow-up, and thank you for presenting to us. Who would be in charge of screening the visitors?
That's going to be done at a facility level. I don't know that we have a specific team that screens visitors coming in. I know our facilities have a visit deputy that does the screening. I'm not completely familiar with that process, so I wouldn't be able to answer specifically.
Any other board member questions, comments? Okay, we'll move to public comment. Thank you.
First, we will call Yusuf Miller.
Yusuf Miller, North County Equity and Justice Coalition, Saving Lives in Custody, California. And I want to say bravo to all the drugs that were apprehended from and protecting our loved ones in jail from overdosing and contact with these drugs from the visitors and whoever may come in. But there's a huge gap between the staff, and at least in this presentation, maybe Senate was not speaking about that part, but we need to hear. What have they been doing with staff? How have they been scanning staff? What has staff been doing? We found in other states where staff has been arrested for bringing things in. Not only other states, here in San Diego County, we had Alan Wareski arrested with drugs in his car in the parking lot of the jail. We've had Corey Ritchie. He was arrested and charged with burglary theft of drugs in the jail drug box. So we really are interested in what's going on. We know at Central Jail, Paloma Serna and the rest of Saving Lives in Custody, when we do our rallies there at Central Jail, there's a huge sally port that they go through and nobody's scanning them. They walk in with their backpacks, their bags, and things like that. They go in. We have people coming in from Grubhub, and we have people coming in from all these other, at least that's the way they're dressed. They're coming in with Grubhub and other places like that to bring in foods. Are they being scanned? So I think we have a huge, we need that gap filled on what we have in presentation on what's going on with those drugs, with those inputs. Those two officers, deputies, are now no longer deputies. Corey Ritchie, like I said, he was charged and he was only on a 2-year probation. That was his charge. I forget what they said that the inmates or their visitors get when they come in, I don't recall. But Corey Ritchie got 2 years probation. Alan Worski, nothing.
Thank you.
Thank you. Next, we will call Paloma Serna.
My name is Paloma Serna, the mother of Lisa Serna, who died November 11, 2019, in custody due to medical neglect. I'm with North County Equity and Justice Coalition and Save Lives in Custody, California. So CNET is, I know they're preventing drugs and contraband, entering the county facility with inmates. But, still I would like to know, or maybe this board could have who's ever searching, the deputies, employees. Because, exactly like what Yusuf stated, we see a different story. We do see deputies and staff not being searched, food deliveries like DoorDash, Grubhub are coming into central jails, buying, for employees, and they're not being checked. I've seen this with my own eyes and multiple times. And I have brought this up to the sheriff department before in the past. So when drugs enter these facilities, people do die. And those deaths are too often blamed on individuals inside instead of the system that allows it to happen. This is a failure of security. This is a failure of supervision, and this is a failure of accountability. So I asked, why are staff not being searched? Why are deliveries not being inspected? And what has changed, if anything? So, there's a lot that needs to be discussed still regarding this. Until that change happens, the death will continue. Thank you.
Thank you. Next, we will call Diana Sanchez.
Hello, good evening. My name is Diana Sanchez, mother of Diana Granio, who died in custody July 13, 2022. And bravo for all the drugs that did get caught within that time frame. And let me tell you, as someone who has been in custody at Las Colinas detention facility before, I have seen many a times drugs come in, many a times, and it's very easy for them to come in. And let me tell you, it's very easy for the deputies to bring it in. And it's very easy for the people who work in laundry to bring it in. It's very easy for the vendors to bring it in. And not only do they bring it in through in booking, but it comes in throughout the day. So I'm glad they're getting it when it comes in, but just as the border, it comes in, just not through the border, it comes in different ways. So they need to, I'm glad that they're doing their job, but they have to tighten the ship, and it is coming in, money talks. So the deputies, they're getting paid fairly well, but not very well. So they get more money if they do bring in drugs, they bring in other things. And I'm just speaking the truth because you know what? I used to be in jail, but now I'm a recovering addict with more than 3 years clean, and I'm on this side now, and I'm doing justice for my daughter, and I'm trying to do the right thing, and I'm standing here advocating for change. I want reform, I want transparency, and I want accountability. And they need to stand behind the badge and do the right thing, or step down. Thank you.
Thank you. Next, we will move on to our online folks who have their hand raised. Leslie Crawford.
Do you need to unmute Leslie or she?
Leslie, can you hear us?
Looks like she's muted.
Can you hear me?
Yes.
Yes.
May I give my time to Yusuf Miller?
Yusuf Miller, North County Equity and Justice Coalition, Saving Lives in Custody, California. Now, first, I'd like to start by saying bravo to Ms. Diana Sanchez for 3 years sober. I really appreciate the work that she's doing, especially in providing and helping with the cases that people have suffered, like her daughter who lost her life. She's still in the fight for her daughter and staying sober at the same time. I want to go back to Mr. Worofsky Worowski, I don't know, I'm not sure I'm pronouncing his name right, but the deputy who got arrested for having the drugs in the parking lot. He, according to his online presence and everything, he's been online present 2022, 2023, 4, 5, 6. So he has not suffered any consequence for having drugs on the property in the parking lot of our jail that compared to the civilians that do the same thing. And this is not fair. This is not right. We're not saying that that we should give people who bring in drugs into jail any less penalty because this is happening. We're saying that it should be an equal playing field for everyone, no matter who they are. They shouldn't be above the law. And when they bring drugs in or associate with drugs, everyone should get the same penalty. But we're not seeing that. We didn't see that with Corey Ritchie. We didn't see it with Worowski. So we need to look into the distribution as well. I'm not sure if that's your area, but the distribution of penalties for these deputies that cross the line. And like was said earlier, that there are other places that are not being looked at. They're not being looked at, and it can show that we have a really beautiful program that's catching drugs, but is it full? Is it complete? Are we doing a full search? It might be something that we're having and we're missing that is impacting our loved ones and costing us lives and custody. Thank you.
Thank you. Next, we will call Beverly Ellinger. Beverly, can you hear us?
Yes, I'd like to give my minutes to Yusuf Miller also. Thank you.
One of the very interesting components of our campaign, Saving Lives in Custody, California, is that we have a mother and mother-in-law of the same person who lost their life. We have a mother here, Diana Sanchez, and then Beverly Alajari online with her, this is her daughter-in-law. Impacted 2 families. 2 families are suffering. 2 families will never get their loved one back. And like Lisa Serna's mother, Paloma Serna, who comes here every day with her daughter, Serenity, they come here and their loved ones pass the exact same way. What is this way? That they were assumed to have drugs, but then denied their medication. They were denied withdrawal medication, which cost them their lives. So this drugs on one hand being in the person's system, and they're being ignored by the methods that what they brought in, not completely searched in the methods that are brought in, but also being ignored for withdrawal when people admit at their check-in that they are withdrawing from certain drugs, and it has cost those lives. It is really important for us to see the impact that it has on these families. They don't just show up all the time because they like being here. I don't like being here. We could be doing other things with our lives, but it is that important. Diana will never have her daughter back. Paloma will never have her daughter back. Serenity will never have her mother back, and so on and so on and so on. So it's imperative that these issues that we bring up, that we should look into. The central jail, where people are just coming with these big bags, Grubhub, DoorDash, and all these things, they are something serious, and they could cause a finding of drugs coming in from these other methods. We've been complaining about this since 2021. We've been complaining about this, and it has been a drop. But I don't think it's from a drop, just from a drop. It's a drop from the activists of these families.
Thank you. Next, we will call Angela Soto.
Hi, I want to give my minutes to Yusuf Miller. Can you hear me?
Yes. Yes, Yusuf has stepped to the microphone. Thank you.
Thank you. Yusuf Miller, North County Equity and Justice Coalition, Saving Lives in Custody, California. And the reason why I'm on this drug issue is because I just came from a presentation from law enforcement on Prop 36. Prop 36 has a way that it provides alternatives to incarceration while giving a felony, increasing the felonies, giving alternatives to incarceration if they go to drug treatment and so on. And we're asking, why is this not as effective as we think it should be? We put the cart before the horse. We made the felonies for drug possession and drug use, but not the funding to the medical and mental, medical and mental health as well, but to the treatment programs that they need. And so now it's just felonies. It's just felonies. It's not treatment. Now, I have had a success story, a family that I'm working with under Prop 36, which got treatment. But you know how this treatment came about? Myself and the parents were turning over every stone, pulling in every favor from every program to squeeze that person in. So they wouldn't just be in a felony and being incarcerated because they wanted to go, but there was no program. So then you have to stay in jail until the program comes. We know people lose their lives in jail. So what do we do if there's no program? We have to fight, scratch, pull, beg, just to get that person in the program. So what am I saying? Is that we have Prop 36, we have the drug intervention, but the drug intervention is poor the way it hit the streets, where we increased the felony, but we did not increase the programs for the people to get help. And it's a beautiful thing on paper, but when the rubber meets the road, we are failing our community by not having programs that they can go to, whether it's mental health or drug addiction. Thank you.
Thank you. Next, we will call Brenda Settles. Brenda, can you hear us?
Can you hear me?
Yes.
Yes, I would also like to give my time to Yusef Miller. Can you hear me?
Yes, we heard you, and Yusef is stepping back to the microphone.
Yusef Miller, North County Academic Justice Coalition, Saving Lives in Custody, California. And I also want to highlight, I want to continue with Prop 36 with the mental health issues. Brenda Settles, her son is here. The Settles family has been fighting for transparency and accountability in the mental health arena, but also in Prop 36, there is not enough mental health funding to go into programs that for people so that they can have alternatives to incarceration for mental health. But when they come out, we've heard from the county, we got plenty of beds, we got plenty of seats. But what happened? Why did myself and the family have to fight so hard for this one individual for mental health and drug treatment? So we need to really look into the number of people that rose in incarceration in Prop 36 versus the programs that are available in Prop 36 for them to go into. And we will really see that Prop 36 did more to just incarcerate people than it is to give people these options, give people these programs. Because we don't have the programs, and the programs we do have, we don't have enough room, enough space, enough beds. And this is a tragedy. It was designed to fail, in my opinion. It was designed to fail. So here we are with a higher incarceration rate, and the benefits from that Prop 36 that was sold to us in the media, that was sold to us in the press, is not being achieved by the community. And we're seeing still the district attorney touting how wonderful it is. Prop 36 has increased and the crimes have gone down. But what has really gone up to make the crimes gone down is the policing. They have more policing, and she said this in an interview, that they police the stores more often, and they police these places. So then crime opportunity is dropped, not because Prop 36 is arresting people and putting them in felony status. So we have a cart before the horse that's really impacting our community.
Thank you, Chair Pintar. That concludes our request to speak for agenda item number 5.
Thank you. We'll move on to agenda item number 6, Executive Officer's Report.
Good evening, everybody. My name is Brett Kawan. I'm the Executive Officer of CLERB. My pronouns are he, him. Our staff has been very busy. We have the annual report coming up to the Board of Supervisors that will be currently scheduled on April 21st. And we have moved into our new office. I'm glad that many of you got a chance to come down and see our space. And you can see why the staff is a lot happier in the space that we are in currently. So we're very happy to get down there. Upcoming, the in-custody death study will be brought to the board next month. We expect the final report very soon to get you in advance of that meeting, and then the individuals that were procured for that study will be available for that meeting. And I letting you know in advance because it's about a 60-page report. And so there's a lot of information in there, and I really hope you get the chance to really dig in and ask those hard questions when we get to that meeting next month. We have now signed 4 different contracts for our healthcare providers. We are still looking for a couple more, but we have been able to also sign contracts with a nurse, a physician, a qualified mental health clinician, and a psychiatrist. So we are now very well covered. We still need, we believe, a little bit more. And with that, we currently have 8 of our in-custody death cases that are within the new jurisdiction. We have 4 other cases, that's Linus, Curran, Heaven, and Dean, that are eligible for the new jurisdiction. However, we have not received a complaint for medical care on those 4 cases. And then also in May, it'll be a big month, the board will get the staff's presentation on intercom policy. And we expect one of our SIs will be giving a full presentation with some potential recommendations to the board. We have received, since the last meeting, 6 appeals on 4 different cases that the board has found sustained findings. It will be a very busy summer for CLERB in that regard, because each one is going to be a different investigation. And on one of those cases, it's 3 individuals on 1 case, and we have 3 different attorneys assigned to those individuals. And so we've marked off multiple days just to handle that particular investigation.
You're referring to civil service?
Civil service, yes. We received 2 policy recommendations from Lieutenant Giardera on behalf of the Sheriff's Office regarding policy recommendations that were made. The first response was from a 21 case regarding 15-minute safety checks for those in the safety cells. Some of that is the time frame when some individuals may not be fully into custody yet, but are being held. That particular one was denied because it's already set up within their system to do those 15-minute checks. The second recommendation on that case was asking for allergies during the booking process, and the Sheriff's Office has agreed to incorporate that into their booking process. So they've accepted that one. And then on the second response, we've had a couple different cases with grievance issues. The policy's been a little bit, wait, yes, just. Device. So the second response was on the 2 grievance policies that the board and us had decided that there would needed to be some recommendations regarding being more clarified within the policy, and they agreed to both recommendations that CLERB recommended on those as well. We are now down to only 3 outstanding policy recommendations, which is a big decline. It's the lowest it's been since I've been here, and so we're getting close on those as well. So we thank the DIS for getting those back to us, the detention inspection services. Our special investigators had a sit down. It was just the investigators with our probation liaison and their staff at their facilities, and we really appreciated the opportunity for our special investigators to get to know them, for them to get to know our special investigators. And so We, again, really greatly appreciate our liaisons and their staff's collaboration to work with us. I do want to address a couple, we get a lot of questions during the meetings and we cannot always respond directly. And so I want to talk about a couple of the things that have come up over prior meetings and another one that had already come up again tonight. One of the requests that the public has asked is for more information in our summaries. I will tell you that we make our best attempt to provide as much information in those redacted summaries as we can allowed under the law. There are many different laws that we have to be concerned of, most of them regarding police officer bill of rights. We have potential HIPAA issues, and so we try to be as thorough and transparent as possible without having issues with the law. So I just wanted to address that. One of the other questions, I think it was asked last meeting, was why doesn't our staff attend the open session? I guarantee you the staff is downstairs in our conference room, our new conference room where they all have a seat, and they are watching every single minute of this particular meeting and paying attention. They have the entire time. It's not something new. We've done that from the very beginning. And I also wanted to thank DIS, again, Detention Inspection Services, our liaison, for providing CLERB with the first notification of a compassionate release since we've had our current jurisdiction. So even though I know one of the callers was disappointed in a response I may have had regarding compassionate release, there was no directives to either CLERB nor the Sheriff's Office. No requirements, no directives on how this was supposed to be implemented. And I really appreciate the ability for DIS to work with us on trying finding ways to make this the best way possible and the easiest way possible to make sure that we are in the know when those things happen. And so we will make every effort. I hope everyone understands that even though we get a notification of a compassionate release, at this point in time, we have not taken the next step, which is notifying either them or their family. I don't think it's an appropriate request to let them know that we're waiting for something to happen. And so we have tried to find some other ways that we're going to try to make sure that we keep track of that. And we know we have still 1 year after that time frame. And so I'm hoping we come up with a good system. Case updates, we did have 2 new in-custody deaths this month, and 4 GBI, great bodily injury cases use of force, and all of those came from the Sheriff's Office. That concludes my presentation.
Thank you. Any board members have any questions for Mr. Kalina about his report tonight? Okay, thank you. Yes, Mr. Mendelson.
Just make sure everybody understands, Brett, could you explain what you meant by compassionate release?
Yeah. So when we were given the new jurisdiction over healthcare providers in regards to health, in regards to in-custody deaths, the supervisors that put that forward added jurisdiction to individuals that were compassionately released by the Sheriff's Office that will pass away within 6 months, so that we can go back in time to take a look at the healthcare that was done at that point in time. So that was added on. Again, really no directives, no requirements of any of the parties in that regard. So we're working as close as we can with DIS to try to make sure we don't miss anything in that area.
Did I answer your question, Jim?
Yes,
okay.
thank you.
Okay. Thank you. We'll move on to item number 7, board chair's report. During Brett's report, he mentioned that we have contracts with our new medical experts, and he told us the various categories of experts that we've been able to make 4 different contracts now for people who will be able to advise us as we move into this new jurisdiction over medical. Many of them, well, let me back up a step. we were required to make sure that there were no conflicts in terms of those providers providing other services to the county of San Diego, and that's not unusual. All the vendors that provide services to the county, attorneys, others, have to make sure that there's no conflicts. So that limited us to people who are out of town, and mostly out of town.
All right now.
Well, all of them are out of town, and many of them are on the East Coast. So they will be providing us their expertise. They're good experts. We're happy with the level of professionalism and skill that we were able to secure. But that means that they will be testifying to us, the board, during closed session. Think about the hour that we typically get into closed session, at a very late hour. So I mentioned this because board members all should have received an email. You all did receive an email from Brett, and I want the public to know too, because you'll see these agendas starting to come out where we are going to go into closed session before this open session meeting. So there will be some closed sessions that start earlier, 4 or 4:30, when we are going to be deliberating over cases in which we have medical jurisdiction, and we need to hear from these experts at an hour that's going to be reasonable to them. So 4 o'clock might be 7 o'clock to some of them. I wanted to explain that, and I think most of the board members did get back to Brett about availability at those hours. And it will be random because we won't have them every month. You'll see it sometimes, and sometimes you won't, but that is why. Mr. Mendelson.
So it's safe to let the public know that we will still start our open session at 5:30, even if we're doing the earlier close.
Just a reminder that for every close, we have to have an open, and so there will be a open session prior to that.
Which
first
will
close.
just initiate the closed session. The actual open session, will correct me if I'm wrong, the actual open session where the public is going to want to attend, as they've been doing, I believe is going to always be at 5:30.
Yes. However, we're required to have an open session
They're allowed
prior
to
to
do
that,
that.
and they're allowed to come and give public comment.
Dwayne, do you want to comment on that at all, or did we?
Am I?
Yeah.
Oh, no, that's great. So board members, what you have to do, if you want to start, you can always take the closed session out of order. But you have to open the meeting, convene the meeting first. Open the meeting, you'll then go in, you'll read your closed session. The public will have a right to comment at any point in time during that meeting. The public always has the right to comment, but you'll just take your closed session out of order and do it first before you do the regular business. But you will convene the meeting first, then go into closed session.
So generally speaking, the regular public comment will still take place at 5:30 when we have our regular open session. But when you see those agendas, you'll understand that that's why we're going into closed session first. And then likely we'll have our open session and go back into closed session for those cases that don't involve an out of town or East Coast time frame for consultants. Wanted to clarify that before we get those agendas circulating. Also, board members just this week received an invitation from Roger Smith, who's the executive director of the City of San Diego Commission on Police Practices, or the CPP, inviting us to CLERB members and staff to an upcoming presentation by California Post. So that's the Peace Officer Standards and Training. There were questions about Post last month, I believe. And so we are invited. This is an open meeting. It's a CPP meeting similar to the CLERB meetings where members of the public can also attend and get questions and learn about what the process is. Now, I think that we received the invitation because Brett reached out asking for a presentation, and they said, well, we're already going to be in San Diego giving this presentation, so we are all invited to attend, and members of the public are invited to attend as well. It is on May 6th at 5 o'clock at St. Paul's Cathedral. And I believe the notification will also be, likely be, it's not up to me, on the CPP's website. So the City of San Diego's Commission on Police Practices. I also wanted to mention that you might see some navy blue bags over to my left, your right, as our CLERB staff moved from the old office to the new office. They found some stuff, some merchandise, I guess, that was stored, and we have a lot of it. So please feel free to take one. It's a bag, a reusable bag, which is great for when you go to the grocery store or other things. There's a nice notebook, a pen, and some other things in there. So please feel free to take one on your way out. That is it for my report, unless any members of the board have questions for me about anything tonight. Yes, Mr. Rudy.
Yeah, just one question on the post presentation. Is there normally an agenda for that? We see it on down.
Yeah, I would assume that we should get some information. It may not be very direct on exactly the topics that post is going to, but I guarantee that CPP is looking at the same concerns that CLERB is, even though we're two completely different investigative models. Right? They do auditing and we do investigations, but I understand that they're looking at the same issues in what post does when they get notification of a serious misconduct sustained finding.
Thank you. We'll now move on to item number 8. Sheriff, our liaison, Lieutenant Georgiou. Hi. Do you have some information for us tonight, or do you want me to jump into questions?
Whatever works best for you. I do have a response to
the questions that were posed to you. Yeah.
Yes.
So what Brett has been doing, our executive officer, he's been making note of the questions that come up both from board members and members of the public during our meetings, and then he is putting them in an email to our liaison and asking for answers to come back to us. And I believe he has some of those answers for us tonight.
Yes. So first question. Well, basically, the general questions had to do with counseling services that were offered. So the first question was, are there mandatory ongoing assessments and do they have to pay? And by they, they're talking about sheriff's employees. So I apologize, I'm just going to read off here. So
that's okay.
Miss something.
Let me just clarify that is completely fine, and we understand as board members that you're telling us something that we may have received in an email, but I think it's really important that not we just receive it, that the public does it, so it's totally fine to read off what you sent us already.
Okay, great, thank you. Yeah, I sent this on March 19th. We do not mandate routine ongoing mental health assessments, but we try to foster a culture where seeking mental health support is viewed as a wellness tool, not a disciplinary action. If a supervisor notices an employee struggling, they can provide a supervisor referral to our counseling services at any point. These services are provided at absolutely no cost to the employee, and we currently offer 2 free avenues for support. One is an in-house mental health clinician. We have a dedicated internal wellness counselor who provides confidential, short-term, solution-focused, non-medical counseling. The second is external counseling. If an employee needs a higher level of care, or our internal clinician can provide a warm handoff to our external counseling provider, they may just go right to the external provider. So the external contract covers multiple free clinical visits in a 12-month period, not only for the employee, but also for their immediate family members. If an employee requires long-term care beyond that, the contractor will coordinate a referral through the employee's medical insurance. Next question was, is it kept confidential, or does it find its way into their files? All services, whether they're internal or external, are strictly confidential, and none of them go into the employee's personnel file. Internally, just to ensure compliance with HIPAA and maintain confidentiality, our in-house wellness counselor does not keep active clinical notes or logs on any client. The only exception to this confidentiality is the legally mandated duty to warn provision, whether they're a danger to themselves or others, or it could be elder or child abuse, anything that comes in. Externally, by contract again, our external counseling providers are required to pay all state and federal laws regarding medical and psychological confidentiality. For both the internal and the external programs, our department only receives generalized anonymous statistical reports. For an example, a number of sworn or professional staff that would see, our general topics discussed like stress or finances. This way they can track the overall utilization of the program. And then we do have some of the different scope of work for our external contract. Get confidential counseling and psychotherapy services for designated department employees and immediate family members. Same services for retired department employees. Family counseling, assessment, treatment, and referral, short-term problem resolution, critical incident debriefing, including monitoring and follow-up, 24-hour trauma intervention, crisis intervention, 24-hour on-scene response to traumatic incidents, supervisor and manager consultation and training. We have peer support training. We also have peer support individuals that are on our department. We have training for designated department employees, and then we have different employee orientations for the academy classes when they're going through the academy, so that they're made aware of all this stuff. And we don't want to wait potentially until they graduate, because something may happen and they may need resources during the academy, not necessarily for us. Those are all from the department, but also on a side note, we do have our union, our Deputy Sheriff's Association, and they do offer different wellness factors as well, including financial resources. Sometimes those provide locations for these things that also take place.
Thank you. Are there other questions for Lieutenant Verdura tonight from the board members? Yes, Mr. Bisson.
Sure. I don't expect you to know this, and I don't want to put you on the spot, so I apologize for that, but
He can't hear you.
Oh.
Your microphone is on.
If you want to take this offline and come back with a response, that's fine. But during the presentation from the narcotics intervention team, mentioned that he didn't have any information regarding the screening of staff or visitors to any of the facilities. I'm wondering if you might be able to discover how that process works, what happens, and let us know. Because it seems like it's an important piece of the puzzle that seems to be missing right now.
I can definitely get you more information, but what I can tell you is quick, basic. At least for visitors, again, every facility is in charge of this, basically the same. They have to present ID so that we can verify that they are who they are, and then they go through a process where they get checked before they. I have to get you more details of how extensive that process is, and I can look into whether the canines are used or not.
Looks like you might be getting some help.
Wrestling.
Thank you. Evening, everybody. My name is Jesse Johns, and I'm the Detentions Operations Commander. I currently oversee medical services, mental health, various other units. I wanted to speak to some of the employee screening questions that you had. Our employee screenings are random. We operate them at every facility depending on just a random pick of which one we want to screen next. It is very labor intensive, which is the reason why we can't have it 24/7 at every facility. We do utilize the canine narcotics dogs, as well as, it's not a body scanner, but they are metal detectors. When reviewing how to roll out an employee screening after the community asked for that a few years back, we had to evaluate and assess employee safety, which there's a certain amount of radiation that goes through for every body scan. And we don't body scan every incarcerated person that comes through intake to that CNET process on a daily basis. So if we were to put any staff through that screening daily, every shift that they came in, they would be exposed to a lot of radiation, which is why we went with metal detectors. When they come in through that employee screening, they drop their backpacks, they're opened, searched, and then they go through another small think it's a Smith's detection machine. It's another X-ray for those personal belongings, as well as the dog sniff and then the metal detector. Any questions, any follow-up questions on the X-ray?
This was the program, and I was going to bring it up earlier when this question was asked, because I knew this was the answer, that this was the program that the sheriff rolled out 2 years ago, I think. This is random screenings at each of the detention facilities, so none of them know where it's going to be on a particular day, and please correct me if I'm describing it wrong, but this is my recollection of what it is. So may not be at every single facility every day, but no one knows where it's going to be from day to day. So it is random, and it does include people who are employed by the sheriff's office. I think the question I had earlier today, but he made it clear that this was not part of his purview, is in addition to law enforcement staff and civilian non-law enforcement staff at the department, there are a lot of visitors who come in and have in-person meetings with people who are incarcerated. So it might be an attorney mostly, service providers. Are they screened when they come in?
They're not screened to the extent of the employee screening piece, but every facility has a visit deputy who is assigned during normal visit hours. And when attorneys are checking in for their visit, their bags are subject to search.
But not a scan?
Not a scan.
Okay. Thank you. Any other questions on this topic while we've got him? Special guest appearance? Yes, Ariana.
So we asked about visitors how are vendors scanned?
I think it would depend on the type of vendor. Vendors that, what's considered a vendor? I mean, we would consider vendors people who are delivering food products to the facility who never really make it into the secured portion of the facility. Like a driver, like a delivery driver for Cisco, for example. That would be considered a vendor, but we would never screen them because they never entered the secured portion of the jail. Other vendors would be considered physicians that are providing service, or mental health clinicians that are providing service that are outside of the sheriff's employment. And they would be subject, if they were coming in for their shift during that employee screening, they'd be subject to the same screening that the San Diego Sheriff's Office employees. So DoorDash individuals never make it inside of the facility either. They come through the visit lobby, and the visit lobby is a non-secured portion of the facility. So the DoorDash component is for people who are employees who might be ordering food because they might not have lunch, or the ODR or the officer dining room is closed. So they're ordering food just to cover their shift. But that person that's delivering that food never comes through the secure portion of the facility. So they're not screened.
I thought the vacation act was fun.
Not my understanding. Yeah, there's a certain amount of radiation that goes through any kind of scan. I know that our tuberculosis X-rays produce more radiation than the Tech 84 body scanners, but there's still a certain amount of radiation that is incurred when we're sending people through those scans. So to send, let's say I have 100 employees at San Diego Central Jail that are checking in various disciplines. I have 45 deputies, 20 nurses. I would have to be scanning 100 people daily, and the exposure to that. There's also union issues. There's safety and employment issues, which are protected by SEIU and the Sheriff's Association. So some of that conversation went into the planning of rolling out these employee screenings.
Maybe we can check it medical. I thought that was the fun.
I know what you're referring to.
Yeah.
Thank you. Well, thank you for your answer. Assistant Chief, you stepped forward. Did you want to add anything?
No.
I just want to say, good evening, Board. Assistant Sheriff Dustin Lopez. I run the Detention Service Bureau. We're not special guests, just for one time. Part of the commitment I made this year, it's coming from this group, Saving Lives in Custody, is basically some other advocacy groups that basically would be here to answer questions just like this. I know it's kind of just concerning to the public when we get questions like this. They have to wait a month, to get their answers. answers like that. So I made a commitment to this group that I would show up along with my command staff or a subject matter expert each meeting. So basically, we answer the questions all this time.
Thank you, we very much appreciate it. It was very helpful tonight to have your expertise, because we did have a lot of questions.
Yeah.
I understand why the presenter couldn't answer all of them. So to have you be able to answer them tonight was very helpful. So thank you for being here. I appreciate that.
We didn't want to interrupt the forum, but yeah.
I understand.
Yeah.
Thank you. Thank you. This is a perfect time to do it.
Actually, do have a small follow-up question. When you spoke about inspecting backpacks, is that done every day or randomly?
It's done randomly with random foot screens.
Okay. And there was also a mention about things like DoorDash. Are those inspected after they're brought into the facility or before, or if at all?
No, it's a food delivery system. It's the same as any process for any employee anywhere trying to deliver, but it's not inspected.
Thank you.
One thing I wanted to realize when we started these random searches, we kept very detailed notes as far as the dates, the locations, what was found, and because we knew this would probably come up for public comment. So we have that data set, recall what
I think it was brought to us maybe after a year, after I'd been in operation for a year, but I have a couple more questions. So, Ms. Fasano?
Actually, my question wasn't about data. I think you heard earlier, I asked for some data on the canine in terms of, the types of things that they're interdicting and the frequency with which they're used and the areas that they're deployed within the sheriff's department. The second piece of that is if we have, you just mentioned we have some data on the operations or the random screening that we do of employees and visitors. So likewise, can we get some data on what's been interdicted when we conduct those screenings?
Absolutely. Well, I knew that was going to be a question when we started these random screenings of what was being proceeded or what was being.
We got the metrics from the special team, and I would like to see.
Yeah, so the fact it just be filtered through what was happening here, based on what activity on those records.
Thank you very much.
We'll look forward to that. Thank you. All right, I think we can move on. Oh, sorry, Dr. Brown, didn't see you.
Okay, thank you. Thank you all for your service and everything. I have a question. I wasn't clear about something the lieutenant said about, and I may be incorrect here, so please correct me if I'm going off tangent. About deputies from a wellness perspective, about what happens to them if they're experiencing any anxiety challenges and everything, wellness program. How is it addressed? Because we know that your work is high, it's very intense at times, and you train for it, but it's a lot of anxiety. It could be a lot of anxiety. What happens when a deputy or someone working for you come forward and say, I need help with this, or I need to feel like this should be addressed? Did you say that that you all have a program for them? And that if they attend that program, there's nothing, no penalties or nothing, it's not held against them for asking for this help, right? Is that what I heard?
Yeah, we have a wellness unit, so we actually have a unit within the sheriff's department. Right. And basically, if somebody comes forward and says they need help, obviously everything's confidential, the person they're talking to, and basically they filter that person to what needs they have at that point in time. As far as speaking to a psychiatrist or different, if they have some kind of substance abuse or something like that, they would filter that area.
It's very interesting. I know you probably can't come back with that because there's always this thought that's out there that deputies, law enforcement personnel don't seek or don't approach leadership for that kind of help because they feel that it would be held against them, that they would be taken out of the field. So you're saying that's not the way things are done these days, correct? Am I correct?
I think things have changed a lot. I actually, on a side note, when I went to the FBI National Academy, I wrote a paper on basically developing wellness units, but I think the stigma over wellness units and basically intercepting people's lives when they're having these difficulties has changed immensely over the last probably decade. A lot, the supervisors are better trained to basically monitor activity. We talk about accountability all the time. You know, even when we see a deputy, you know, not performing at the level that they normally perform at, basically you have supervisors intercede and say, hey, is everything okay at home, or, you know, experiencing something. One of the bigger things in the sheriff's department too, if anything is a critical incident, such as, you know, an officer involved shooting or use of force or something like that, we have the supervisors checking in with that deputy, you know, weekly, monthly basis, basically saying how you're doing mentally, you know, how are you feeling, is everything okay, checking on that person. And I think it's well respected within the department, if they appreciate them being checked on, and basically will step forward if they need the professional help.
Do you have a lot of deputies or people who take advantage of that wellness program? I'm not asking for any data right now, but do you have a lot of people stepping forward asking for it?
I'm trying to, because I do know the numbers roughly in my head. I don't think it's a large number, but I will say, yes, there's people taking advantage of it. And, you know, as the commander said, sometimes it's just not, you know, a mental issue too. It's basically, you know, some of these deputies have financial issues and stuff like that. It's an array of things that causes stresses. But yes, I think quite a few people take, you know, knowing the numbers that I know, quite a few people take.
And that's encouraging. I'm going to tell you that my hand goes out to you for doing that, because it's obvious that the job is very hard, very, you know, we don't see a lot of hypervigilance in our law enforcement establishments. So thank you for that. Now I'm going to come back to you another time and ask to, you know, if see a review of that, and you know, we often talk to guys like you, but is it possible to just talk to deputies, have someone who's actually doing the work in these jails or out in the field, some new step forward? Because, you know, I'm not saying that you don't have an understanding of what they're going through, but it might be a little bit different at your rank and everything to truly understand what the deputy field goes through. I'm not trying to put you on the spot, but
no, absolutely. If somebody wanted to step forward on the mic, I definitely encourage you.
Okay, all right. That's all I got to say. Thank you very much. Thank you.
Thanks.
Yes.
I'm sorry.
Yeah, you said earlier on the outside employees come in, local duties, the guys who do construction work, fix whatever, and their stuff would be backpacks or whatever they're going to check. I'm just curious about you know, background checks of some of these folks. I would assume that the county would have a core set of electricians, plumbers, guys, they've already done background checks on.
That's correct.
Okay.
DJS they do the background checks.
So you have to bring an outside contractor.
So an outside contractor has been in, they're escorted by deputies in the facility, and basically the deputies stand by them, with them as basically what they need to do inside the facility. That's rare to go outside DJS, but it does happen sometimes on technicalities inside the facilities that, you know, I can think of right now where we're implementing the tablets. And you know, a lot of the infrastructure is going on with tablets as far as fiber optics and stuff like that, but we have to have these that basically stay with modern facilities.
Oh, thank you.
Thank you. Answered everyone's questions. Thank you. Thank you again for being here. Look forward to seeing you again.
Absolutely. Thank you.
Thank you. Yeah.
We will move on to our probation department liaison. I think we have a different person here today. Supervising Probation Officer Clara Pastora. I believe you have some information for us, a response to a question that came to us last month or the month before.
Yes, good evening. So Supervisor and investigators usually want to present information, so I'll be presenting on her behalf. So I had the question she provided was, is the mental health of those in probation be monitored and treated?
So for the juvenile, we have a contract. Our contract, integrated healthcare provider is CHP, Correctional Healthcare Partners. And they provide robust mental health services with mental health professionals, which include child psychiatry, child psychology. This entails like the full gamut of services, so evaluation, diagnosis, treatment, and follow-up. In addition, probation staffing includes mental health professionals. So we have alcohol and drug program specialists, correctional counselors, and mental health case manager specialists. They work in conjunction with CHP to ensure holistic and individualized care plans. On the adult side, we have the IHSU Adult Behavioral Health Treatment Team. It includes alcohol and drug program specialists, known as ADPSs. They receive referrals from the reentry and probation and pretrial probation officers. Once a referral is received, the ADPS meets with the client and conducts an assessment using ASAM, which is American Society of Addiction Medicine. It's a screening tool. And then the tool evaluates the clients across 6 dimensions to determine the most appropriate level of care, which can range from outpatient to inpatient treatment. After identifying the appropriate level of care, the ADPS links the client with community-based providers to begin services. In addition, often clinicians are assigned to each region to support clients in accessing mental health services. Assessments are conducted to identify appropriate level of care. The adult reintegration and community supervision services includes behavioral health supervision unit. Behavioral health court officers work collaboratively with clients to ensure they are connected to appropriate services throughout the duration of their community supervision. The secondary question was, once probation has ended, how are we ensuring that care continues to hopefully prevent future interventions with law enforcement? So once probation is ended, we do not have jurisdiction anymore. However, through the advent of going live with the CalAIM program, the reentry and referral process has been made more robust. Reentry incorporates Medi-Cal enrollment, referral to managed care plans, enhanced care managers, and behavioral health links to county behavioral health services. And prior to a client's probation ending, the probation officer works with the ADPS and or current service providers to ensure services necessary to support them. Any ongoing needs are put in place before the end of the probation.
Thank you. Thank you for bringing us that response. I don't remember who asked the question, but appreciate getting a response tonight.
Thank you.
Anything else for our probation liaison tonight from board members? Yes, Ariana.
Do you want to test young girls when they're entering for pregnancies?
I'm sorry, do we test them? Well, I couldn't hear the question.
Do you test young girls when they're entering juvenile hall for pregnancy?
When they're entering juvenile hall?
Are they tested for pregnancy?
Yeah.
You know, I'm not sure if they're tested. I know there's questionnaires that are given by the medical staff there, but I'm not sure if that is something they undergo. If that is a question that you'd like an answer to, I can check back.
Yeah, that would be.
Okay.
They must receive a medical screening.
They do
similar
go
to
through
incarcerated
medical
people
screening
in our
and
adult
they
detention
they go through various screenings, but I don't know if there's a pregnancy test that's given maybe automatically to all of them. That I don't know.
Okay, thank you.
Okay.
Here's a question that you posed, you need to clearly either.
If the minors are tested for pregnancy.
They're tested for what?
Tested for pregnancy when they enter
Okay,
the
thank
detention facility, the youth detention facility. And she said she would come back to us with an answer.
Okay, thank you.
Thank you. Anything else for our probation liaison? Thank you. Thank you.
Thank you very much.
We will move to item number 9, new business. There is no new business tonight, so we will move to item number 10, unfinished business. And that is, remember last month I asked for members of CLERB to serve on a nominating committee because it is time to elect officers again. So the executive committee is the chair, the vice chair, and the secretary. And I asked for people who would be interested in serving on the nominations committee, and I'm appointing the nominations committee tonight. It is Mr. Norm Nissen and Mr. Brad Woods, and Mr. Woods will serve as our chair of the nominating committee. So any members of the CLERB board who are interested in serving as an executive officer, please be in touch with Mr. Woods in the next few weeks, because he and Mr. Nissen will be putting together for us a slate of officers, proposed new officers, and we will be voting on them at the following meeting. So we'll hear the nominations next month, and then the following meeting, we will vote on them. Any questions about that?
Does it matter how long you've been on the board?
Does it matter how long you've been on the board in order to nominate somebody? No, anybody is eligible to be nominated for an officer position. So that includes the existing officers. So each of the existing officers are eligible to serve again. And any of the members, in fact, that was one of the questions that came up. Are the new members eligible to serve as officers? And they certainly are. So anyone who's interested in serving as an officer, please let our nominating committee know, and then we will vote on those nominations at the following month. Any other questions about that? All right, then we will move on to item number 11, board member comments. Any comments from any of our board members tonight that you'd like to?
I would just like to say,
Dr. Brown, can you make sure your microphone's on? Because we all want to hear you.
okay. I just want to say thank you to our law enforcement people who really, there's a lot of sacrifice. I hope I said they sacrifice a lot. I know that often in the public at times are pretty hard, but I'm so grateful to you. We're looking for you to come to us and tell us what you need help with. Just don't by yourself. If you need help and stuff, let us know, because we, part of the public people we serve. We have to be part of the process of solving problems. With that, I'll say thank you, and I'll yield back to the floor.
Thank you, Dr. Brown. Any other comments from any of our board members? Mr. Bisson, is that I thought you were raising your hand. No.
No, but since you called me, I'd like to second what Dr. Brown said, and thank you guys for coming out and explaining some stuff to us. We appreciate it.
There are no other comments from the board tonight. We will move into closed session. If our council could please call us into closed session.
Thank you, Honorable Chair. There'll be two recommended closed sessions. First one would be pursuant to Government Code Section 54.957, subdivision D1, to discuss public employee performance evaluation. The executive director is under discussion of that item. Second category of closed session would be again, pursuant to Government Code Section 54.957, to discuss complaints or charges brought against employees relative to information that's being confidential in Code Section 4.3.2.8. Recommendation.
Thank you, Dwayne. Mr. Bennett. And for the benefit of our investigators that are listening in tonight, we will take a short break, but I'm going to take item B first. We'll go through our caseload first and do our deliberations, and then we'll come back to the performance evaluation. Okay, thank you everyone for being here. Please take the bag of stuff on your way out.